Welcome to Field Notes, Insights from New to Public Health Alumni. New to Public Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, New to Public Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Lisa Kwiat, Communications Coordinator and Public Information Officer with Waukesha County Public Health Division of the Health and Human Services Department in Wisconsin. Lisa graduated from the New to Public Health Residency Program in April 2024. Lisa, thank you so much for being with us today. Would you please
Thank you for having me.
Absolutely. Would you please start by sharing how you came into the field of public health?
Sure. The unique part is I wasn't necessarily seeking out public health. I was seeking out health and human services. And in Waukesha County, public health is a division of health and human services. Post-COVID, they were looking for a communications position within public health, but it was listed under the Health and Human Services job board. And I had been involved with Health and Human Services about 20 years ago. I adopted a sibling group of 3 and had a really great experience. I was really impressed on how the entire process went. I'm so thankful that they're kind of a part of my family coming together. And although most of my work was in the private sector for about 25 years, I just felt this draw to Health and Human Services. I checked their job board every week for probably 2 years, hoping that there was some job that I was qualified for. So when the job came up as communication coordinator at Health and Human Services, although I didn't know anything about public health, I knew a little bit about what Health and Human Services did. I knew that they had fantastic social workers that really cared about people in that department. And I just figured that probably spread through that whole department in general. So I applied, and it's a little bit of a slow process in government when you applied. It's not like you go for an interview and you hear the next day. It's a longer process. And I had to develop an entire campaign for my interview. And that was something I was very well versed in. I had worked on a lot of campaigns in my lifetime. I have a background in graphic design and advertising. So that part was really fun for me. And thinking of having new content to promote rather than the things that I had been promoting in the private sector really piqued my interest. So I started to think I really, really wanted that job. It was a couple months before I actually secured the position. And they were willing to take a risk on me, knowing I had no background in public health. They really took the time to give me opportunities to learn, which is how the New to Public Health class idea came up. And I'm just so thankful for that class. It just went through so many things that helped me in my first year or two at public health. It just helped me understand the history of it. So yeah, that's how I got into public health, really, was just looking for a position at Health and Human Services. I'm so thankful I got that position. I know there were quite a few people that applied, and I was not really qualified in human services, in the human services degree area, but I'm so thankful they took a chance on me, and I still really, really am thankful and appreciative of the job every day. And it's like learning something new in midlife. I'm 51 years old, so I started this job when I was 47. And it's so fun to learn something totally new at that age. So I really like it.
Oh, I love that. It's such a heartfelt story into public health. And I think that's one of the really unique things about people working in public health is when our intrinsic values and our lived experience matches the values of the organization that we're working for. And I think that marries really well to then give back to the community. Um, so thank you for sharing that. And you touched a little bit that your workplace was really intentional about offering you trainings to get up to speed on public health issues and knowledge and competencies because you're obviously very competent in the communications aspect and it's just a little bit different topic areas. So do you want to talk any more about how New to Public Health helped assimilate you into your role and maybe about the project that you did?
Definitely. There's so many acronyms in public health and in health and human services. For example, CHIP. There's a lot of talk about CHIP. CHIP is the Community Health Improvement Plan. And people that have a background in public health or a master's degree in public health have a totally different level of understanding of a chip or how a chip can work and how much collaboration needs to go into that process. And I could tell that I just was not the one coming up with ideas or knowing what to do. I was very much a listener my first year or two within all the chip meetings. Um, and that's actually what another thing that sparked me trying to research what could really give me a little bit more background in public health. And when I looked at the chapters offered throughout the New to Public Health program, there's like an entire chapter on CHIP and so many other things, the history and um, environmental health, which we have an environmental health division as well. So there's so many things that I needed to get that baseline historic piece and education that I thought could bring me to the next level in my communications. And that class just really brought it all together in an organized, structured way. Um, it introduced me to both the people and the purpose behind public health work. It encouraged me to build relationships within my own division and cross divisionally with all the different things it asks you to do. There were countless resources for books and education to educate yourself further. I did find myself really kind of falling in love with public health and once you understand why we have public health, it's a whole different thing. It's like the door opens and the amount of reading you can do to educate yourself is limitless. And I just found myself not having really enough time, but that class structured me enough where I was actually allowed to carve out 2 hours a week during work to dedicate to that class. But it really elevated my level of understanding of why we're doing the things we're doing.
That is great to have that organizational support and feel like you're having that organized path to take in these new concepts in a reasonable way and then be able to apply them right into the work that you are doing when sitting in on those chip meetings and moving communications through um, the organization.
Yeah. The other thing I really loved was the mentorship availability. So I was in a little group with my mentor and a couple of other people in the class. And the other people in the class were from different areas of the United States, but also working in a similar capacity in public health. So it was so eye-opening to see how different public health divisions and departments may run their chip differently. Different communities have different health priorities. It's just so interesting. There's no real boring moments there. It's all about people and community and the want and need to have things better and more accessible.
Absolutely. We are taking strides to break down some of those silos in public health and learn from each other and work together. And I'm glad your mentorship experience helped facilitate that for you.
yeah,
You
definitely gave me, I feel, a smoother transition to my position. So,
excellent. You mentioned for your project in New to Public Health that you worked on content creation for social media, and we're recording this just over a year after you graduated, and I know that has really taken off. So tell us about where it started and where it is now.
sure. So part of the reason that I think they wanted to hire a communications person in public health is they found out during COVID, they had to use all of their employees to serve our community. And there wasn't really somebody fully dedicated to communications in public health. So the types of social media posts they were doing, while they were informational and great, they did not have time to be strategic, or it was a lot of just sharing what other people had done. So when I got there, part of the position entailed managing that social media. Now social media can be a full-time job that you could put 40 plus hours a week into social media if you would like. I knew that I had many other responsibilities besides social media. Although I think it's important, it wasn't the main focus of my position. So I wanted to do a better job at being strategic with it without putting in too much additional time. So I asked if I could, maybe get some help to strategize this. We have a strategy team at Waukesha County Public Health, and a person in that strategy team is our epidemiologist. So the first thing we needed to do is find out where we were at right now. How are our posts doing? What is a reasonable goal to how many times a week do we want to post? What does the content of those posts look like? Are we just going to be reactionary with our posts, or are we going to plan out what we want to do? So nobody had ever really been a social media manager for public health prior to 2022, but there were a lot of dedicated people contributing, just not in a strategic, organized way yet. So myself, as well as the epidemiologist, studied where our numbers were at right now and kind of ideally what we thought we could do within 6 months to a year. So through that research, we found out that posting twice a week was probably going to be good for us. Time-wise, it wasn't going to take me all that much time to do 2 posts a week. We also had multiple pages for Health and Human Services, which we still do. And my dream is to someday combine those pages into one. But what we did do is we turned the public health page into the Health and Human Services page. So now we can actually post for all of our divisions, including public health. That also took a little bit of weight off of public health being the only one to post multiple times a week. So we share posts with all of our divisions on that page, even though they still have their own separate pages. So finding all of these things out and sort of setting up a strategy was something I did with our epidemiologist. And then we assembled and recruited a content creation team. I didn't really want all of the posts coming from me. I wanted to know what other people thought. I wanted different age perspectives on what we were posting, different graphics. Although they were different, we still want to adhere to our brand guidelines. So we still want it to look and feel Waukesha County, but we want to reach as many people as possible. So I assembled a team of about 10 people within the public health division, and we only meet once a month. We talk about what we want to post for the entire year now in January. We make sure we cover all the foundational elements of public health. We look at the special months that highlight, for example, Mental Health Month. We make sure we have mental health posts that month. So we try to be really strategic about what we post and when as a team. And then we allow each person on the team to come in and grab the posts about promoting STD testing, and they're managing that STD program. Those posts look a little different than someone that's maybe not in that program or in the trenches every day. So I'm so thankful for that team to bring me these great ideas. And a number of them are on platforms that we can't post on, which is like TikTok, and Snapchat. And they see things that are trending that we don't necessarily get to study in public health, but they bring these fresh, cool ideas. And it really helps our team put forth so many new, fresh ideas that I probably would have never come up with on my own. So I'm eternally thankful to that team. And then knowing that if we have to pivot, they're kind of there with me to pivot on how we need to do things. So it worked out pretty well. And it's just the work is never done. Things change constantly in this field. And we're looking to always study that and collect our numbers regularly. But we did see some significant growth on our engagement during our time of study for the Lean project. So we took the before numbers, we implemented the new strategy, and then the after numbers, and we actually doubled our engagement. Now, let's keep our expectations low here. Public health posts are not getting thousands and thousands of likes. They're very, if we get 10 likes instead of 5, that's amazing for us. So what's exciting though to have the actual concrete evidence that our engagement went up.
That is so exciting. And I just love the collaborative strategy to bring everyone together. And I think that gives each of those work areas some autonomy in moving forward the information that they know is most important. Because you're right, in public health, not one person is the expert on everyone. Everyone is working together. So to intentionally bring that into your communication strategy makes so much sense.
Yep.
And I have to celebrate you a little bit because your team has actually been recognized for this work. Tell us about that.
Well, there's a couple different things that I get to do in my position. So I'm also a public information officer for Waukesha County, and I get to work on projects that are HHS wide, which also include public health. So we had gotten to utilize some opioid settlement funds last year and created a video series for the fentanyl crisis that we have going on in Waukesha County. Um, since we released that video series, we've been nominated for a couple of awards, which have been really, really humbling. The first one was for the National Information Officer Association. We were nominated in the top 3. We did not win, but it was just such an honor to be nominated. So that conference was down in Florida, and it was just exciting for people outside of even Wisconsin to think they were even watching what we created. But we took the stories of our local Waukesha County residents and told stories from 4 different viewpoints. So we have our loss and remembrance. Loss and remembrance was local parents sharing their stories of losing children to fentanyl poisoning and shedding the light on the need for awareness, education, preventative measures. Some of those days that we were recording that video, I was in tears, interviewing people. So hard, but so meaningful. And I'm so thankful for their bravery to tell that story. We also have a video called Road to Recovery. It captures the journey of a few Waukesha County residents, courageously sharing their stories of overcoming their substance use challenges. We have Heroes Among Us. It's spotlighting the heroic efforts of our frontline workers. They all have so much passion, so much courage, so much commitment. to helping people. So we highlight them. And then we have what Waukesha County is doing to battle the crisis. Um, and our county executive speaks in that video as well. And you can tell that it's a passion project for him as well. He has close friends affected by this crisis. And I think after watching these videos, you kind of feel like everybody has someone that they know or is close to them in some way, whether it be a neighbor or a really good friend that knows someone that's affected by it. So it was a passion project to do for me, but it was outside of the norm of what we typically do. And we're glad that we were able to utilize opioid settlement funds for this. It doing these videos elevated our communication to a level that would have been hard for us to do without that.
Absolutely. Well, that sounds like a really impactful video series, and congratulations so much on being recognized for that work. I know how much time and heart went into those, and they really did turn out beautifully. We'll link in the comments section below where listeners can maybe go and view those videos later. So, as we wrap up, I just want to say thank you again so much for sharing your story of how you came into the field of public health, how you helped strategize that communication process through social media and in this special video series that you did. So, as we wrap up, is there any other advice or tips that you want to share for other organizations looking to lean into that communication strategy a bit more?
Um, you know, I would say that you have to give everything a little bit more time than you think. Nothing is done very quickly or swiftly, especially when you use strategy. But when you take the time to plan and include other voices and other people, I feel it turns out much better in the end. So even though there are times where you have to react quickly, we actually have meetings that help us prepare for acting quickly. So we have a whole preparedness team where we work on messaging for different things that could come up far before it might even come up. So if you can carve time out to be prepared, and to strategize, you might be just one step ahead, or at least you'll feel a little bit better. Things won't be as foreign when something actually happens. So that would just be, that's what I hope for. I hope I can continue to do that in a successful way, and contribute as much as possible, and lean on those connections within my division department and in other ones as well. I think the collaboration between different public health divisions is a huge plus. To be able to call someone else in another county or another state, have them totally know what you're going through, and have resources for you to use, it's really a gift. And I think that the culture in public health is to share. So I'll gladly share a lot of the work that we've done. If somebody else wants to um, put their logo on some of the posts that we've made and show our videos to their staff or their area, we would love to share it with you. So it's all about collaboration, help, and partnership.
So eloquently said, Lisa. It has been such a pleasure talking with you today. Thank you so much for sharing all that you did and for that encouragement going forward of working together, sharing, because public health is for the collective, and I
Yeah.
think that's a great mindset to carry forward. So thank you for being with us.
Thanks so much for having me today.
Thank you for listening to Field Notes, Insights from N2PH Alumni. For more information, Visit new, publichealth.wisc.edu.